Hi, good morning, everybody. Today, for learning objective 4 in the health and ill health module, we're going to be looking at things to do with research. So what I'll do first, I'll show you what we're going to be looking at today. So just bear with me a second. Right, learning objective 4 is to use health data and research. And in order to complete the assignment, you must be able to understand and use these. So 4.1, in order to achieve a pass in the assignment, 4.1 is analyze valid and reliable sources of health data and research. And 4.2 is to interpret published health data and research. Okay, so what we'll do first is we'll look at the indicative content of today's lesson. And these are sources of health data and research. For example, within the UK, the NHS and the NHS digital services, globally, World Health Organization. And when you're doing your assignment, you must use at least 3 sources from these or from others as well. We're going to be looking at an overview of research methodologies, methods, data analysis, data management, ethics, research governance, dissemination of data and research in each source. We look at a critical review of research. It's important to always do a critical review when you're looking at any kind of research, because then you can work out if things are true or they're not true. Look at how to ask appropriate questions and validate research and data sources. How to interpret the data and the different graphs and the information, including the steps to carry out an analysis and interpretation of data, including drawing valid conclusions. And then we also look at health and statistical terminology. For some of today's key terminology, I've listed 2 things on 2 slides. The first one is research methodologies. Now you'll come across this, and this means the specific design used to identify, process, analyze, and evaluate a research topic. So it's about the methodologies that people use. It's important to look at ethics. Researchers must follow set guidelines when they're doing any research to ensure people's human rights are respected. For example, respecting their confidentiality. It's about making sure that the people you use for statistics are kept safe. A critical review is always important. It's important that you evaluate a research project. So you look at the whys, the why nots, and you weigh up the balance of them. When you're doing research, one of the methodologies used is qualitative data. And that means research information that isn't represented by numbers. For example, if you were doing research, you'd observe how people would behave. And you'd also ask people how they're feeling about different things. Another methodology is quantitative data. Now, that's the opposite of qualitative data. With quantitative data, research information is used that can be measured or counted. For example, age and how many. So it's all to do with the numbers. You'll see the term meta-analysis, and that's the statistical combination of results from 2 or more separate studies. Demographics, those are the statistics that describe populations and their characteristics. For example, the population's age, their race, and their sex. A p-value is something that you can see, and the p stands for probability, and it's a probability that an occurrence would happen by chance alone. I've continued the key terminology on the next slide. And epidemiological research is another one. That means a human study that links health effects to a possible cause. For example, cancer can be caused from exposure to a particular substance in the atmosphere. So something in the environment's caused the cancer. The Bill and Melinda Gates Foundation are put down there as well, because that's mentioned on the slides. Now, they're based in Seattle, in Washington, Seattle. And Bill Gates is well known, as you know, for starting the Microsoft Foundation. Now, this foundation funds global research and works to help people lead healthy, productive lives. The Médecins Sans Frontières is another one that's mentioned, and that means Doctors Without Borders. And this organisation gives medical help to people who are affected by conflict, especially in war-torn areas, disasters, when you have things like earthquakes or volcanic eruptions, or people who are otherwise excluded from healthcare services. A bias is mentioned quite often, and that's a belief that some people or some things are better than others. And when that's followed, it usually results in people being treated unfairly, especially within the health service. Inferential tests is another terminology that's used, and that means statistical tests to discover whether research results can be used to generalise a population. And lastly, I put regression model, and that's a function that describes the relationship between variables. One really good example of that is the relationship between the height and the weight, and that can be shown on a graph using a linear regression model. So you join the dots and then you put a line between them. The next slide, I put a video on there, and there's so many videos on YouTube that you could look at, looking at all different kinds of methodologies to do with research. They're quite long, so you do need to spend some time on looking at these. I found a short one that just describes really quantitative and qualitative data, but it's worth a watch and you can do that later. Now we're going to analyse valid and reliable sources of health data and research. And analysing valid and reliable sources of health data and research is crucial. It's crucial for evidence-based decision-making. And it's always to have evidence-based decision-making within research in order to go ahead with anything. You need the evidence to prove that something's going to work. This informs healthcare practices. So let's examine some key sources. We've got government agencies, and don't forget we're using the US for our example of a different country. So in the US, they've got the Centre for Disease Control and Prevention, which is also known as the CDC. And this provides comprehensive data and research on various health topics, including infectious diseases. Those are the diseases that people can catch from one person to another. Chronic conditions, those are the things that happen within you, like cancer and heart disease, obesity and diabetes. And they also look at public health surveillance, so they keep an eye on what's going on with people's health. The other organisation there is the National Institute of Health, also known as the NIH, and they conduct and fund biomedical research on a wide range of health issues. They publish their findings in peer-reviewed journals, and they make data available through different databases and repositories. And a repository, that's a term that they use for something they keep the information in one place. So all the details of everything is all kept together in one area. It's not moved around or shared. We've got the World Health Organization, also known as WHO, and they're a leading global authority, as we mentioned before, on public health. They provide data research, and guidance on health-related issues across the world. They publish reports, they have different publications. And they've got databases that offer valuable insights into global health trends and all the challenges that these impose. A really good, important place to look for information on research is academic journals. Peer-reviewed academic journals are primary sources of health research, publishing original studies, systematic reviews, and meta-analysis conducted by researchers and experts in the different fields. Examples of the different journals are JAMA, the Lancet, and the New England Journal of Medicine. They're always worth looking at. The journals are always really important. You get lots of information from them. We've got health surveys and databases. National health surveys, such as a National Health and Nutrition Examination Survey in the United States, provides valuable data on populations' health, so on people's health, including the different demographics, different health behaviours, and disease prevalence. So they're looking at the wide range of what's going on with people's health. We've got health databases, such as the electronic health records and disease registries. So when people have infectious diseases especially, they need to be registered so people know what's going on in different areas, and they hope that they can contain them. These health databases contain patient-level data that can be used for epidemiological research and also clinical studies. So the information is available on these databases without actually going out and speaking to different people about them, so long as people give their consent to share their information. International organisations. Now we've got other international organisations, such as the European Centre for Disease Prevention and Control. And we've got the United Nations, who also produce health data, reports and research to give information on global health policies and practices. So there's lots of places to find the information on different research. The non-government organisations, these involve health research and advocacy. We've got the Bill and Melinda Gates Foundation and the Médecins Sans Frontières, who contribute to the generation and dissemination of health data and research findings. We've got professional associations and different societies. Professional associations and societies such as the American Model Association, the AMA, and the American Public Health Association, the APHA, who produce research and guidelines relevant to their different respective fields and their specialities. There's a clinical trials register. And the clinicaltrials.gov especially provides information on ongoing and completed clinical trials. So anything that's happening at the moment, and it's very current, they can be found on there, including the different study protocols, the outcomes, and the results. These enable transparency and access to research findings. So transparency means that it's open, there's nothing hidden, and you can see exactly what's going on. So in conclusion to that section, analysing valid and reliable sources of health data and research is essential for evidence-based decision-making. It's really important that you have the evidence base. Policy development comes from analysing the data. And healthcare practice also comes from that. Government agencies, international organisations, academic journals, health services, databases, non-government officers, professional associations and clinical trials registries are among the key sources of health information and research findings. These all contribute to advancing public health and improving patient care globally. So they're all very, very important. But it's also important to share that information. By critically evaluating and synthesising data from these sources, the stakeholders, don't forget, those are the people who are all got a vested interest in what's going on, they can gain valuable insights into health trends, risks, and interventions that are needed, which ultimately lead to better health outcomes and the promotion of population health and well-being. So research, valuable research, is really, really important and moving things forward. For the next part, interpret published health data and research and how to do that. Interpreting published health data and research involves critically analysing the findings. So it's really important that you criticise. You don't just take things as they're written down there. You look to see, why did they do that? What did they hope to achieve? What's going on? Did they do the right thing? Could they have done something different? Identifying key insights and understanding the implications for healthcare practices, policies and decision-making. So in order to interpret published health data, these all need to be in place in order to make things and make decisions. Here's a guide on how to interpret published health data and research effectively. We need to understand study design. By understanding the study design, methodology and population characteristics, consider factors such as the size of the sample that's used, the study duration, how long did it last? Was it like days, weeks, hours, months, years? And what data collection methods did they use? And were there any potential biases? Did they tend to favour like older people rather than younger people in a survey? What biases did they have? Evaluate data analysis. In order to do this, you need to assess the statistical methods used, including descriptive statistics, inferential tests, and regression models. You need to pay attention to the different measures of effective size, confidence intervals, and the p-values to determine the strength and significance of associations. You need to evaluate all the information in front of you and weigh up to see whether the things that were used were appropriate. In order to examine results, we have to review the main findings of the study. So we look at any tables that they produced, any figures, and also read the narrative summaries. You need to identify key trends. What patterns did they have? What was the relationship between the variables? You need to look for consistency across the different measures and the subgroups. You need to look at the limitations, consider the limitations. Look at the sampling bias, confounding variables, any measurement error, and the generalization. Assess the potential impact of these limitations on the validity and reliability of the findings. Did they make a difference? Did they affect anything? It's also important to compare anything that you find to existing evidence. Place the study findings in the context of existing literature and evidence base. Compare and contrast the results that you have with previous studies, meta-analyses, systematic reviews, and the guidelines to identify areas of agreement, disagreement, or uncertainty. You always have to compare anything that you find to existing evidence. We need to assess clinical relevance. We need to be able to evaluate the clinical relevance and the implications of the findings in order to improve patient care, clinical practice guidelines, and healthcare decision-making. You need to consider the factors such as the size of the research that you did, the surveys, the clinical significance, and the relevance to specific patient populations. Was everything relevant to the people that you had in front of you? You have to consider public health implications. These are important for population health and preventing disease and making sure that health promotion efforts are valuable. Need to assess the potential impact on healthcare policies, the allocation of resources, and public health interventions. So everything that you're looking at in the research has public health implications. So we need to make sure that everything's done correctly. If in doubt, seek expert opinion. Consult experts in the field, including researchers, clinicians, epidemiologists, and statisticians, to gain additional insights and perspectives on the study findings. So speak to people about what you've found. Find out more information. If you had the possibility to do so, it might be good if you could attend conferences and seminars, and even join journal clubs to discuss research findings with peers. You can find out more about things by talking to people about them, especially when you're not sure. Any findings must be communicated. So you communicate the interpretation of your findings clearly and effectively. The stakeholders who are involved with this have got a vested interest. They need to know exactly what's going on in order to be able to provide funding. These include healthcare professionals, policymakers, patients, and the general public. Use plain language, so it's language that people understand. Use visual aids, so people can see. If they're not understanding the words, they can actually see things in front of them. Use real-world examples, because they make things more relevant to people. These all enhance understanding and facilitate decision-making. So how you communicate your results is very important. In conclusion to this section, interpreting published health data and research requires a thorough understanding of design study, data analysis limitations and implications. By critically evaluating research findings and considering their clinical and public health relevance, all the stakeholders can make informed decisions, and these will shape evidence-based policies, improve healthcare outcomes for people and all the populations. So they improve healthcare outcomes for everybody. Effective interpretation of health data and research is essential for advancing knowledge, promoting evidence-based practice, and addressing key public health challenges. So all the research that we do, all has to be done correctly. It's got to be evaluated, and then it's got to be laid out to people in the basic terms so people understand exactly what's been going on. We need to find evidence-based proof in order to inform practice. And that concludes today's session. There are 2 slides there on different references that you can research and find out more information. Thank you very much for attending today. Hope you have a good day.